as we give an update on COVID-19 and the coronavirus in our community. We have, of course, more information to update. This is always an ever-changing situation. There is, of course, more cases in our community, which we'll talk about very soon. I'll let the doc talk about the issues associated with the healthcare aspect of it. We will also give you more information with regards to some of the actions that are going on. There's a lot of things that are going on behind the scenes that most people aren't even aware of, including our friends in the media. They don't understand some of the things that we're dealing with, and I'll talk a little bit about that. As always, we are dealing with a situation that is constantly in flux, and we always put the proviso out, which I think most people have heard right now, that the information is presented, including in this PowerPoint, is only as valid as it was at the time it was entered in the PowerPoint. It may have changed since then, and we might not even be aware of it, just because that's how things have been going lately. You'll hear, of course, from our Department of Health Commissioner, Dr. Gail Burstein, and myself. There are other representatives. We have very few people in this room. There's 3 right here, 4, 5, 6, 7, 8, 9, 10. We have a few others scattered out. Our Deputy County Executive, Maria White, is here. And that's basically it for some of the team leaders we've had that we've been running the show. Michael Breeden, the head of our IT department, is here as they've been actively involved in increasing bandwidth and ensuring that individuals across the county who need it are getting the information they need, and our staff members are getting the information that and the supplies that they get so they can work off-site. But a lot of other people are across Erie County working very hard, whether it's in the Rath building or elsewhere. So with that, I'll turn it over to the doc to talk about some of the most recent testing information.
So as of Monday today at 2:45 p.m., there have been 87 laboratory-confirmed COVID-19 cases in Erie County, and that's from all the labs that were receiving information. From the Erie County Public Health Lab, there have been 379 negative results among Erie County residents. There are currently 171 pending results among Erie County residents, and there have been 466 tests that have completed or are pending by the Erie County Public Health Laboratory so far.
Excuse me, I move that. And I also want to note that we are aware of multiple other testing agencies that are testing currently, and we believe that actually over 800 county residents have been tested through Quest, LabCorp, a couple other agencies that are testing right now. We're hopeful that some of the hospitals, as we said, will be online any time now. So we want people to understand that just because you see 466 tests completed by the Public Health Lab, there's actually many more Erie County residents who have been tested, but through private third parties.
Right. The commercial labs are all on board, and so we're receiving many tests every day. So just in terms of Erie County residents who are test COVID positive, we see them in a variety of age ranges. And among the hospitalized patients, today there are 11 confirmed COVID positive patients that are in one of the hospitals in Erie County, and 2 of those are in intensive care units. And these individuals range all ages, and actually the majority of them are in their 20s, 30s, and 40s. So this is not just a severe disease among the elderly. I mean, we're seeing it among middle-aged people. So as of today at 2:45 p.m., there were 87 people in isolation. There have been 176 people who have completed quarantine, and there are currently 351 contacts in quarantine. So I think the bottom line is that we have to assume that COVID-19 is prevalent in our community and that you may have been exposed. We have not reached our peak yet. Every day we're seeing more and more cases, and there's no reason to believe, even though we're not testing a large number of new people, that we have reached our peak. Even with the limited testing that's been done, we're receiving more and more positive reports every day. So I think that we have to assume is that there are a lot of people walking around that haven't been diagnosed because they haven't received a test, and that doesn't mean that those people aren't ill walking around in our community. So I think that there's nowhere that you can go that you can assume that you'll be safe from COVID-19. I think you have to assume that anywhere that you go, you could be exposed to somebody with COVID-19. And so for that reason, if you see that you're on one of the lists of places that we said that there could have been a public exposure, you don't need to call our hotline. You've probably been to other places that weren't on the list where you have been exposed.
And if I can note, based on the discussions I've had with the epidemiologist, almost all of the newer cases that are coming in are community spread cases. These are not individuals who traveled outside the area. About an hour ago, I had a conversation with the mayor of the city of Buffalo, Byron Brown, and I did confirm to him that there are cases of COVID-19 in pretty much every part of the city of Buffalo. The east side, the west side, North Buffalo, and South Buffalo all have at least one case, and we do know that the most recent cases are almost all community spread. So as the doctor has noted and I have noted, even if we're not listing a particular location, you should assume that if it's where a lot of people have been, a grocery store, a department store, you name it, there's probably someone who is there that has COVID-19 at this moment. They may not be showing symptoms. As you may have seen yesterday, Senator Rand Paul of Kentucky was determined to be COVID-19 positive, and he was not showing any symptoms. So there are people around our community right now who do not have any symptoms that have COVID-19, and they can transmit it to someone else. And so we want everyone to understand that.
Right, because again, nobody's traveling right now, so all these new cases were likely contracted here in Erie County. So, again, there are certain people that we really want to prioritize monitoring on, and just because we don't tag you as being a known contact to a known case, we still want people to be sure that they monitor themselves for the symptoms of COVID-19, of fever and cough or shortness of breath. And so where we really want to focus our monitoring, and our healthcare systems are helping us so much with this, are our healthcare providers, people working in our medical facilities, testing their temperatures twice daily. We also want people who are close family contacts, like household members or partners, people have close relationships to people who have known or suspected COVID-19 cases, to really monitor themselves. And then also, we really want to worry about people who could become very, very ill with COVID-19. And so that's, again, our elderly and people with other chronic healthcare conditions, and smokers too. So this might be a reason where you might want to think about quitting and start nicotine replacement therapy. But again, we want to make sure that we monitor those individuals, and because they could become very, very ill. So this is a picture of our interactive Erie County COVID-19 map, and this displays all the positive cases by municipality, and we are updating it every day, and we're working with our Department of Environment and Planning, GIS Division, to update this. But again, this is a huge underestimation of the total number of cases in our community. So just because the area where you live is not highlighted red does not mean that you do not have COVID-19 in your community. You do have COVID-19. We have no reason to believe that you don't. So again, it just could be a way to keep track, and the numbers are increasing. We know that there is COVID-19 everywhere that we go. So for that reason, since we're assuming that it's everywhere and there is community spread, we really want people to take ownership of monitoring themselves for illness. So, and not only to protect themselves from becoming very, very ill unexpectedly, but also to protect the people around us that we love, especially our elderly and people with chronic conditions and smokers who could become very, very ill if they're exposed. Especially to somebody who is symptomatic, which is much more likely to transmit illness. So the symptoms that you need to monitor for are, first, fever, and that's a temperature of 100.4 or greater, and either cough or shortness of breath. So if you had that spectrum of illness, that means that you should assume that you have COVID-19, and then you should definitely isolate yourself and inform your loved ones that they may have been exposed. Also, if you develop these symptoms and you're worried about your healthcare status, you should call your healthcare provider or an urgent care center or emergency department before you go in. I mean, first of all, most people have a mild or just a moderate course of illness, and they don't need to be hospitalized. So if you want some great advice, many people can be managed over the phone. Just call your healthcare provider or call and if you feel that you need to be seen at one of these facilities, call ahead so they can prepare, so they can have the mask ready, they can have the personal protective equipment ready, they can usher you right back into a room so that you don't expose other people. But we need to know ahead of time in the healthcare system if you're going to be coming. And most people can be managed just like influenza at home, without a test and without having to be seen by a healthcare provider. So, so March 22nd, yesterday, Dr. Anthony Fauci, who is the director of the NIAID at the NIH, said not every single person in the United States needs to get tested. When you go in and get tested, you are consuming personal protective equipment like masks and gowns, and those are high priority for healthcare workers who are taking care of people who have coronavirus disease. So again, it's not a good use of resources. It not only expends the precious PPE that we have in our community, it also uses up tests that we may need to reserve for critical people like healthcare workers and first responders. And then also it could expose other people, like you go out in your car, there are other people in your car, they could get exposed. So again, it's not a good use of resources. We know what to do if somebody is positive. We know how to manage them, and you just don't need a test to suspect that you have COVID-19 and take the appropriate actions.
Thank you, Doctor. Want to make a switch here with our friends from Deaf Access Services? Talk a little bit about some of the things that we've been dealing with at my office and others have been dealing with in regards to the response of COVID-19. We know that there is a shortage of PPEs, personal protective equipment. I've been in touch with the governor's office and had a phone call just recently. Actually, I'm always in touch with the governor's office, it seems like, but I had a phone call just recently from a high-ranking staff member who informed us that we would be getting some of the priority items that we requested a couple days ago to ensure that we have an appropriate amount of masks. Earlier today, I authorized the purchase of 400,000 NIOSHA, National Institute of Occupational Safety and Hazard Agency, which is part of the CDC, approved N95 masks from an international manufacturer for a purchase price of $1.1 million. A lot of people are saying, we'd like to make masks for you. That's great. Unfortunately, they don't meet the standards of NIOSHA. This is from an international manufacturer that already is approved and has been producing masks for years now. We were able to get a lead on that and actually get a pretty good price. A lot of other masks are going for almost $10 a mask. We were basically able to get it for $3 a mask. The payment will be made upon delivery, because I know people are asking, and we make sure we don't get ripped off of our money. The first 50,000 initial shipment is going to be received. It's being delivered by air carrier. It will be received not at the Buffalo Niagara International Airport, but another airport in our Great Lakes vicinity. We will send people out there to drive and pick it up, so we're not going to rely on third-party providers. I am worried about the potential loss of these. I don't want to hear the old story of the box falling off the back of the truck. I want every single one of the masks that we're paying for to be delivered here. And then we will have additional shipments on a weekly basis of hopefully 50,000 until we reach our 400,000. And they will be distributed with our Erie County public health officials, law enforcement, as well as area healthcare providers based on priority and need. I am not waiting for someone to just give us things. I know if we do that, we're not going to get the supply that we adequately need. That's why I authorized the purchase of these 400,000 NIOSHA N95 masks at a purchase price of $1.1 million. And I thank the Erie County Legislature for giving me the opportunity to do that with the recent resolution that was passed by them authorizing the $5 million of special funds for COVID-19 response, as well as giving me the opportunity, which I basically have in an emergency anyway, but authorizing me to make these type of purchases on a snap decision as to rather than having to approach the legislature and getting their approval 2 or 3 weeks later. So that is something that I decided today. I thank my purchasing department as well as the Department of Health and others who were able to identify these and procure them. We now have them locked in, and I'm very grateful that we will have these, but it's still going to take some time. We're expecting shipment in about 10 days or so. So it says 4/11, but we've been told the first shipment could be the 10th in 10 days. We should have hopefully a good portion of them by April 11th. On social service aspect of it, temporary assistance for needy families or individuals who still need assistance. I walked around the building today and there were very few clients, but some that were coming in. If you want to apply, you can apply by phone at 858-8500. No in-person interview is required. Everything can be done on the phone. Of course, you can do this online as well, but we want people to understand that our Erie County government is there to assist people and families in need. So temporary assistance for needy families is up. Normally, you'd have to do an in-person interview and so forth. That is being waived at this point. You do have to provide documentation to our Department of Social Services, but we are doing everything by phone. Child care for essential workers. My deputy county executive, Maria White, is here. She's been at the front of a task force that's working on child care for essential workers. The Child Care Resource Network for Western New York is acting as a clearinghouse for providers who have eligible slots and parents who are essential workers needing slots. You are to go and fill out a survey at www.wnychildren.org. Once again, that's www.wnychildren.org. So if you have slots as a daycare provider, please let us know. And if you are an individual who needs daycare, please fill out that as well. I know the Deputy County Executive has been hard at work, including school districts. I'm going to ask the members of the school districts, we appreciate your assistance, but if you're only open for 6 hours a day, it's not really helping us. The governor's orders were for school districts to provide daycare, and we need 24-hour coverage in some situations. We may not need it from every school district, but remember, there's healthcare workers that have to go to work in the middle of the night. They may work the 11 to 7 shift, and daycare from 7 o'clock in the morning till 3 really doesn't help them. We've had some that have said, hey, we'll do it from 8 to 2. That doesn't help us either. We need daycare in all hours of the day, and we're asking all the school districts to help participate in that. A 6-hour daycare window does not help us when we have workers who work second shift, third shift. So please, to all the school districts, we appreciate your assistance in daycare, but we need all shifts, not just one shift during the day. Restaurants, of course, support our local restaurants. Public health sanitarians are inspecting local restaurants to ensure they're complying with the standards that are required of takeout and in-store facilities. We want everyone to understand that just because there has been this change in our daily life doesn't mean that we are ignoring the things that we have to do, especially when it pertains to restaurants. So restaurants that are open, they should potentially expect a visit from one of our sanitarians to confirm that they're following proper guidelines, as well as, of course, we want people to take advantage of the area restaurants, order by phone, charge via credit card. There are a lot of places that are doing pickup at the curbside. Some are still offering delivery, but we want folks to understand that we need to continue to patronize and support our local restaurants. We've been doing it here. We've been mixing it up in the Rath building. I know a lot of staff have been doing it. We don't want to just patronize the same one. We want to ensure everyone has an opportunity to generate some revenue in this issue we're dealing with right now. But please patronize your restaurants, and you can go online and find a lot of them that are available right now. Essential workers, there's a lot of folks out there who are working exceptionally hard, not just in government, but in the private sector, to provide essential services, including grocery store attendants and others who have to work with the public. And I thank them all for the work that they're doing. I know that there are some that have reached out to us saying, I've never worked as many hours in my life. People are getting a little frazzled. We're doing the best that we can, and I think that's the response that we want people to understand, is they are doing the best that they can. Yesterday, I joined with representatives of Tops and Wegmans to remind people not to hoard food, to not go under the situation that this is a panic and there's not food and other supplies there, because the food and other supplies are available. And if you go in there and you're really being nasty, we've heard issues in some of the places of fights among customers who are fighting over goods. You may find yourself in a situation you don't want to be, which is in our holding center, because if you're arrested, you could be thrown in our holding center. So is that extra roll of toilet paper worth it to find yourself sitting in the holding center because you assaulted someone? Those are the kind of things that we want to stop. So I joined with Wegmans and Tops to issue a statement with regards that the food supply is there. The chain of food delivery is still continuing. We're not running out of food. We're not running out of toilet paper. We want people to understand that. So be courteous to those people that are working at the grocery store. They're putting in tremendous hours like a lot of other people. Act appropriately, and we'll all get through this okay, because as I've said before, we are all in this together. This is not all for one, all for ourselves. This is we are all in this together, and if we do that, we will be better for it. Our Erie County parks are open. Once again, we've had a lot of usage in a couple of our parks, including Chestnut Ridge Park, and I know the city parks have had high usage in Delaware. Erie County's got 10,000 acres to enjoy. Yesterday, there were a lot of people out across Chestnut Ridge, but we heard sporadic use at our forest and some of the other pocket parks and even medium-sized parks we have. Pick a different park if you want to go out. Get out there, have fun. Do it in your small group of your family. Don't do it with 15 or 20 other people. A few days ago, I saw, actually yesterday morning, it feels like a few days ago, but yesterday morning I was looking outside my house at the North Buffalo Command Center from the front window, and I saw a group of about 15 runners run by. Not smart. If you were all separate by 6 feet, it might be good. But all together in a pack, not really good, because each and every one of you is potential transmission of COVID-19 to the other people. And we know when you're running, you sweat, you cough, the runners are not necessarily thinking at that moment about what they do if they spit. They may be releasing COVID-19 if they spit. So I want people to understand that those pack of runners that were going by, you might think you're great, but as the doctor noted, the individuals who are hospitalized are generally younger. We're not talking about people in their 70s and 80s. We're talking about people in their 20s, 30s, and 40s. And just because you're in great shape as a runner does not mean that you can't get COVID-19. So I want to remind that to everyone. Have a good time, but do it in the small sizes. Religious services. There was a story in the Buffalo News today about some local religious churches that were open over the weekend, and they were trying to protect individuals by using hand sanitizer and the like. Our recommendation, even though I know it's a difficult thing for others, is to try to avoid religious services at this point. You may feel healthy. You might actually have the illness, or worse, even if you're 10, 15 feet away from someone, they may have it. It could be if they touch a pew and you put your hand on the pew, you may get it yourself. And we want people to understand that it's really smart at this point to try to avoid crowds of more than 10 people. If you have to be in those situations, space it out. We know it's not easy, but to the reverends out there, the rabbis, I know the Catholic Church has basically stopped services at this point, but they've opened churches up for prayer. We're just asking all and everyone, imams and the Muslim faith, please be smart. If you're going to have a service, which we're not really recommending, you do it in such a way that you're protecting all of the people that are attending it. And I can tell you right now, conversations I've had with others, you cannot 100% protect your facility. You cannot 100% protect your congregants. And we know a lot of the people who like going to services often are people who are of advanced age. And these are the last people we want coming in contact with people they haven't been around. So please, think twice before you go to a religious service. I'm saying that not because of any issue against religion. It's just because we want to protect people so you have an opportunity to go to a religious service in the future, not because you catch COVID-19 and have an illness and unfortunately pass away from it. Our COVID-19 call center, of course, is open 8 to 8 each day, 858-2929. We've heard the numbers of calls have dropped, but they're still fairly steady, but they're not like they were. People are thankfully asking legitimate questions. If you have a hypothetical, please don't call. We're not here to answer hypotheticals. If you have a question about other service, like garbage pickup in a town or something like that, you should call your local town officials, or 211 is available. So for just general information, call 211. If you're feeling stressed out, at your wit's end, don't know what to do, feeling like there's no hope, please know there is hope. Call 834-3131, which is our crisis services hotline. That is 24 hours a day. We want people to know there's lots of services that are available for you during these trying times. And once again, the important websites that you can go to. We've been dealing with a lot of other issues that most people aren't even aware of. We've been working with some of the city of Buffalo and others with regards to homeless population. We know a number of homeless shelters have had to reduce the number of slots they have, as well as some that are potentially even closing because of lack of personnel to provide the services at the homeless shelter. I know the Buffalo City Mission is still open, but there are other smaller ones that have closed their doors for the time being. So the Erie County Department of Social Services, as well as others, are working with various agencies, including the Homeless Alliance of Western New York, to address these issues with homelessness. We are aware of a number of issues associated with individuals in varying occupations that have COVID-19. We tried to get that information out. I am aware, as has been announced, there are healthcare organizations that have individuals that either in them as a patient or actually have had employees who've tested positive for COVID-19. That's why we're saying to everyone, please go under the assumption that it's everywhere. If you're thinking you can get away from it just because you haven't seen it on our map or you don't know anyone personally, I can tell you this, you can't get away from it. I have actually seen the list of individuals who have COVID-19 in Erie County, and I know a couple of these people. And I wish them all, everyone who has it, hopefully a very speedy recovery. I can't imagine the feeling you get when you get the news from one of our epidemiologists that the results came back positive. Thankfully, most people who get COVID-19 recover. There have unfortunately been deaths, and of course many in New York State. There have been 2 that were announced in Monroe County, and just before we came on air I saw a report that an individual in Wyoming County had passed. So COVID-19 can be deadly, but we want people to take things seriously because we want to ensure that we are reducing the spread of the illness. We're doing everything possible to ensure at the end of the day that we've protected as many people from the coronavirus, so there will be hopefully no deaths in our community. And if there are deaths in Erie County, it will be the least amount possible, not the highest amount possible, because of individuals ignoring the rules and thinking, I'm immune to it. Nobody's immune to it. With that, I think we can open it up for questions. Of course, we have our COVID-19 resources on the website. It's also available in Spanish for our Spanish speakers. WinCosh is providing information, as we announced yesterday, to many other languages that are available in writing. I don't know if they have interpreters available at all times. I know the International Institute does, but they may not be available for every language at any one time. But WinCosh is providing it in written form, so for people who speak other languages. I just want to once again remind everybody, we're all in it together. There's a lot of people that are working many, many hours. I'm starting to send people home from the health department and other areas saying you got to take time off. I can't have you here all the time. We are worried about burnout. I know the same thing with hospitals and other organizations. They've had a lot of calls in because people do not have the ability to have somebody watch their children. They maybe would have left their children with their parents, the grandparents, but they're afraid to do that now, potentially exposing the grandparents to COVID-19. So there's healthcare workers, just like we have Erie County employees, who've had to take time off because they have to watch their children. That's why it's so important that we fill the child care network, those slots that are available so that first responders, healthcare professionals, individuals in government that need to go to work can find the child care that they need. And if we do that, and we continue to do this, we will get through this together. It's a trying time, unlike any we've seen in our life. Basically haven't had something like this in the United States for almost 100 years, since the influenza outbreak during World War I. None of us know anybody who lived through that. But I just recently watched the American Experience program on it, and it was scary. And I hope we don't get to that point where we were as a country back then, because if that's the case, there's a lot of us that are here today that won't be here in the future. That's why we need to do everything possible now to protect ourselves, our family, and our neighbors by not exposing others to the coronavirus. With that, open it up to questions. Lines are open, and this time we will start from the top. So we're starting with WKBW-TV. I believe Madison Carter is on.
Yes, sir. I want to frame this question the right way because I think we can certainly appreciate the fact that Dr. Bernstein is saying, you know, testing is not curing people. We need to go under the assumption that it's everywhere, and we have been telling our viewers that. But just this morning, Governor Cuomo, he said, you know, direct quote, he said we have to go where the need is, follow the signs, follow the data, go where the numbers are. So I guess my question is, are you concerned that if we can't produce those numbers because we don't have the ability to test, we won't get some of those resources that he's talking about? He said there should be masks for all, and enough masks for everyone, and we just spent $1 million.
Well, I'll let the doctor also talk about it. They are worried about a huge epidemic in New York City, and it's probably a legitimate point because of the size and density of the city, where there are people living in 50, 60-story skyscrapers. There's a New York Times story today that talks about New York City being the epidemic, or the central point of this epidemic in North America. And I think there is a legitimate concern, because if it gets out of control in New York City, their healthcare system will not be able to handle it. We have an issue here. We're not denying it. We are getting new supplies. We talked about getting reagents tomorrow. We do have some good news. We don't know exactly how much, because we just got this information before we came online, but we just found out that more reagents were received at our public health lab about 20 minutes before we got on TV. So the reagents that we were told were going to come tomorrow have come, or some of them have come premature, or earlier than we thought. And I also want to thank Congressman Brian Higgins, who worked with us to get these additional reagents from the federal resources and the CDC. So thank you to Congressman Higgins. So we'll be able to do more tests through the public health lab. We'll have more information on that when we know exactly how much we have from sample kits and reagents. But New York City is really the epicenter of an epidemic. And we don't, thankfully, have the density that New York City does, where we have 1 million people over 1,200 square miles of Erie County, and they have, I think, 13 million in just a few square miles because of the size of New York City. So I understand why New York State has been sending the vast majority of the tests for New York City. I wish we had more. I'm not going to deny that. We've been fighting for more. We do know that Quest is testing. LabCorp is testing. Actually, I saw from the results today, we actually got a result from the Mayo Clinic, which is in Minnesota, from one of our residents. And we also know that another organization is testing as well, because a number of those results came from that other organization. The name just escapes me. It was a different name I hadn't recognized before. So tests are being performed on Erie County residents. As we said, we think about approximately 800 people have actually been tested in total between all the different agencies. And we do expect more, and we've gotten more reagents because of Congressman Higgins. So thank you, Congressman Higgins. Doctor?
Sure. Well, again, you've heard that we are not the only area of New York State or the United States that is really limited by the resources to conduct these testing, not only the viral collection test kits, but also the reagents. So today we did receive some additional reagent. We're hoping we can do somewhere between 300 or 400 tests. And we have to be smart about those tests, because we don't know when and, if and when we will be able to get some additional reagent after that. So just like everybody else in New York State, I think testing really needs to be limited to critical individuals. So like our healthcare workers. So we have to know who is positive there, because that will affect when they have to leave and when they can return back to the workforce, and potentially other ill people in the hospital or the healthcare setting that could have been exposed. We also have to think, limiting tests to essential personnel like our EMTs or our police agencies. So those are all individuals that would really affect, how we can live, how we can survive in our community, and we need to prioritize testing there. So we're not the only place in New York State or the country that is making these decisions. As you know, every day we're getting more and more positive tests, so those tests are still being done. We're still identifying more people that are positive, and there are other ways that we can look at trends. We are going to be working with our partners in the community to look at illnesses, respiratory illnesses trends increasing, and while looking at our influenza labs positive tests decreasing. So we know that discrepancy is probably from COVID-19. So again, we have other ways to follow trends, but again, what it means to us, people in the community, is that there is community spread. It is here in our community, and there is nowhere you can go where you can assume that you are completely safe, even in your own home sometimes. So just take the appropriate precautions with non-pharmaceutical interventions.
Thank you. Next question to Marley Tuskus of WIVB Channel 4.
Yeah, thank you. So today we discussed the number of people that are currently being treated in the ICU is 2. That's down 1 from yesterday. Would you say this is a good sign for what people can expect to be treated?
Each case is different. I mean, these are small numbers. Again, I think that people haven't realized that we still have to brace for the peak. We still have to brace for the storm, and this is going to be a long haul. And I doubt we have seen our peak yet, and we're going to see more and more people that are hospitalized. We're going to see more and more people that are in the intensive care unit. And this is just the beginning, and we're fortunate that today there's maybe one less person in the ICU compared to yesterday. But tomorrow there will probably in the upcoming weeks there will probably be more. So. Again, we can't have this false sense of security. Our hospital systems are all working together to make this community effort. So we're putting together, one hospital for people who need higher acuity care, working with Catholic Health at St. Joe's. Kaleida Health is going to designate an area to serve people who, again, are admitted to any of the institutions, to receive them for people who need lower acuity care and still need to be hospitalized. They're quite not well enough to go home. They're not sick enough to need high intensive care. So Kaleida Health is going to take all these people. And then in Erie County, we're looking for a place to house people that who are COVID-19 positive or contacts that don't have anywhere else to go in their home. So again, we're working together as a community. We're getting prepared because we know the numbers are going up, and this is going to be a long haul.
Thank you. Is anyone there from WGRZ Channel 2?
Yeah, Steve Brown's on the call.
Hi, Steve.
Thank you. Hi, Mark. Hi, Doctor. I'm a little confused about a couple of things. We have 466 tests that have been completed at the Erie County lab, another 171 pending. You believe that from outside, the number is closer to 800. That still puts us far behind smaller counties in upstate New York. Now, I appreciate that we're not the only place that's running short on these materials, but we're running shorter on these materials than other counties that are smaller than we are. So, Dr. Burstein, by quoting Dr. Fauci about not everyone needs to be tested, are you trying to reduce expectations for people out there that testing will be available for them?
Yes. Again, we have a limited number of resources for testing, so we have to be smart about who needs to be tested, because those individuals who, if they are positive, are essential workers, including our healthcare workers, will affect our ability for care for other people in the community. It'll affect our ability for law enforcement, for first responders, to keep the lights on, to keep the food stocked in the grocery store, to be able to purchase food. So again, we have to be really careful with for who we use these tests. And I can't say that we will have enough to test everybody in the community. So that's why, we know that there is community spread. We know that this is prevalent in our community, and we know that the numbers are going to get higher. So with that information, we can be empowered to take the appropriate actions to stay healthy and to keep the people in our lives who are very vulnerable to infection safe. And I think that's what we have to do. That's our working presence. If we have 200 people positive or 1,000 people positive, that have test positive, we still are operating under the same assumptions that we have community spread and many people are infected, and we have to practice our non-pharmaceutical interventions to stay healthy.
So people should just expect not to be tested.
I think that, again, we'll look at this by a case-by-case basis, but right now, of what we know, the resources that we have in our laboratories, many people who may meet the criteria may not get tested.
The one thing we are also dealing with are individuals who have no symptoms, no criteria, saying, I have to get tested. Well, there's no reason to test them. They have no symptoms. They don't meet any of the criteria. And that's why we're trying to remind people we're saving the test for the individuals who at that moment need it the most. Next question to Brandon Lewis from Spectrum News.
Hi, I just wanted to know if people continue to not practice social distancing at parks in the county, would you consider closing down parks in Erie County?
Well, the difference is we have lots of parks where people aren't even going to, and those one park, Chestnut Ridge in particular, where lots of people are going to. We would theoretically at that point potentially limit the amount of people who could actually go to the park. We do have the ability of closing the park, closing the gates. I would not want to do that. That's why we're asking people to choose another park. I don't want to have to close Chestnut Ridge. Chestnut Ridge has got over 1,200 acres. And what's happening is a lot of people are just going in the area around the casino and that top part. Well, that's the smaller side. The big side is the western side. When you come in off of Route 240, most people go left. If you go right, it's actually the bigger side. And so we're just asking people to utilize common sense. There's lots of other parks out there. Pick a different park to go to. I do not want to have to close the park. We do need to have them open so people can have some outdoor recreation and activity. We're just saying don't do it in large groups, and if you can, avoid a crowded location, because there's lots of other parks that we have that are hardly having any attendance. And that's why I want people to try out the different parks we have. As we say, we have 10,000 acres to enjoy. So get out and try to enjoy a whole bunch of those 10,000 acres, not just the same 1,200 acres that are at Chestnut Ridge. Next question to Sandy Tan from the Buffalo News.
Hi, yes. I wanted to piggyback on Steve Brown's question. So Erie County is the largest county in upstate New York, as you know, and if you include if you're looking at New York City as
Seem to have died out, so we're replacing those. I think we're back on. Do we have sound again? We have sound again. Sandra, why don't you re-ask your... Yes, we can hear you. Why don't you... We had no problem hearing you, but the public could not hear us. So can you please ask your question again?
All right, so I will... Certainly. I was framing this question a little bit. Erie County is the largest county in upstate New York. It falls within the top 10 of communities across the state with the highest number of COVID-19 cases, and yet the number of tests that have been completed in Erie County is exceptionally low. It amounts to less than one test per 1,000 residents, even if you were counting the 800 or even 900 tests being done with the help of private labs. So my question is, how did Erie County get here? Why is it that the number of tests that Erie County has is so few? Did the Department of Health just grossly underestimate how many tests we should have? And if you could elaborate a little bit on what is being done now to get your hands on more tests. I know you've said you've reached out to a number of different resources, so if you could elaborate on that as well.
We have tried our best through all resources possible to be able to obtain reagent and specimen collection kits. So it's just a limitation of the market. And I think that actually what you're saying is the relatively lower number of tests done and the relatively higher number of positive tests gives concerning information in itself, that we have a large proportion of people that in our county who were tested that are positive. So we can assume that we have a large proportion of people who were not tested in our community that are positive. So I think that also gives some good information. We're doing everything we can to get enough tests to test the people that we feel are a priority. Again, we know what COVID-19 looks like. We know what we have to do for people who are positive and people who are contacts. We also know what to do for people who have not tested positive and do not have symptoms to prevent them from getting infected. So I think we have the information that we need, and it's being supplemented by testing people who are at high risk and sensitive individuals.
Next question. I'm not certain if they're on the line. WBFO Radio. Have no one from WBFO, WBEN, Brendan Kearney.
Has the number of confirmed cases in the county increased slower or faster than what expectations would have been when we first learned of the first case, or were there really no expectations originally?
We've never had this epidemic in our community before, so I think we didn't really know what to expect. Generally, what we are seeing is an exponential increase in the number of cases, and we continue to expect to see more and more cases as we do testing. Even though the testing is limited, we expect to see additional positive test results come to our health department every day.
I'm just watching the numbers, and we know that for every individual, at least as in the Wuhan area, that contracted it, they usually pass it on to 2.2 other people, and that's those that contracted it, not those that were confirmed to contract it, and that's why you could get into thousands and tens of thousands and potentially hundreds of thousands. We're concerned because if we got to hundreds of thousands of area residents contracted it, looking at the death rate, it would be substantial. So we're trying to reduce that by telling people to practice smart physical distancing. Be close. You can be socially connected through the phone, through the internet, through those sources, but be physically distant so you're not sharing an illness that could kill people. Next question is to the B newspapers, Ethan Powers.
Hey, Mark. Thanks for taking our call. At this point, it's well documented that there's a shortage of medical supplies and hospital beds. In the coming weeks, if we do indeed see a surge of cases and specifically hospitalizations here in Erie County, can you just speak, Mark, for a second about the county's contingency plan if there are more required hospitalizations and ventilators than the county has access to?
Well, ventilators is like the entire country is having a problem with ventilators. We are working on acquiring the other means necessary. If we had to open up other facilities, a triage facility, or turn hotels into actual hospitals. We know of manufacturers locally who make some of these supplies. We've had representatives reach out to them. We've also had some of those companies reach out to us, and we continue to have those discussions. Thankfully, we're not in the situation where we would be, at least it appears New York City could be very soon overloaded with patients. We're getting reports, I've heard from some of my colleagues downstate that the emergency departments in some of these New York City hospitals are just wall-to-wall patients. And that's a scary thought because this is still early in a pandemic. And if you I don't know where they're going to be 2 weeks from now, and I hate to think about it. We've had time to put some protocols in place and to, as I said, was able to identify and acquire, or at least put the order in today for 400,000 officially approved N95 masks. And if we need to, we'll be doing the other things necessary to purchase other supplies. The hospitals are under the gun. The governor today mandated that they increase their capacity by 50%, and also said he's hopeful they'll be able to increase their capacity by 100%. That's not easy. Their capacity is also controlled by New York State, so they may be able to add beds in a lot of these hospitals, but if you were to increase by 100% in many of these hospitals, they'd be ripping out all kinds of rooms that aren't necessarily made for hospital patients that they'd have to turn into actual rooms for a hospital patient. So there is going to be an increase in the number of beds in our community as mandated by New York State, and we're doing what we can to help support that.
Right, and I just want to add, our healthcare systems are all working together to, to address these anticipated growing need for these acute care beds. So again, like all the hospital systems are working together. So Catholic Health is going to have the one designated hospital for a very high acuity care for COVID positive patients. So they're going to accept patients from ECMC. They're going to accept patients from Kaleida. They'll accept patients from any institution that needs to send them in Erie County. And so they'll be the point of care for higher acuing patients with COVID-19. So then that'll help with, again, with being efficient with resources, with ventilator beds. That'll may help us be more efficient with personal protective equipment, and that'll help us be more efficient with decreasing nosocomial transmission, or that spread within the healthcare system, because it'll all be in one designated site. Then Kaleida Health is joining in, and they're participating in this community effort. So they are going to designate a site to house patients that do not need that highest level of care with COVID-19, but that are not well enough to go home. And so again, there'll be more efficiency with bed. There'll be more efficiency with PPE, and there'll be less spread within a specific hospital system. And then Erie County, we are going to house those individuals that do not need any type of hospitalization and otherwise do not have a place where they can stay in isolation or quarantine for COVID-19. So again, our healthcare systems are working with the county to come together as in the community to pool our resources to be more efficient and smart to be able to address the anticipated healthcare needs of our community. So I really want to commend, all our healthcare workers and all our hospital systems in our community for coming together and working together and not working in silos.
Yeah, I talked to each chief executive officer of the 3 hospital units, Tom Croce from ECMC, Jody LeMayo from Kaleida, and Mark Sullivan from Catholic Health today, and have been on the phone with each of them many, many times over the last few days. And they are all pledging to work together. And that's a great thing because we need them all to work together for our community. Next question, back up to Madison Carter from Channel 7.
Yeah, on that same line of working together, I was talking with the CEO of Catholic Health about their new rapid test system, and I'm just curious as to how the county is planning to partner with them. They're saying they can put out all this information, but do you think the county is going to be able to keep up with inputting some of that information and getting that out if they are performing 800 tests per day?
Well, first off, they don't have the capability yet. They put in the order, the initial order. They don't have it yet, so I don't want people just running to the Catholic Health organization to get tested. First off, there is a system that New York State has, and so any test has to go into the system. It's called the eClair system. I'll let the doc talk a little bit more about it. But that information goes to the state, goes to us. But if they did a test, let's say 800 a day, and they got 400 positive, yeah, that would cause a huge overload on our epidemiologists and how they're able to respond appropriately if we had hundreds of more cases daily. But I'll let the doctor talk about the system.
Right, so we get all the positive test results for COVID-19 from the New York State Electronic Clinical Laboratory Reporting System, or eCLAIRS. And we get that for all reportable communicable disease, including COVID-19. So again, if Catholic Health is doing tests or Kaleida is doing tests, we will see those test results. And if we get overwhelmed, if we get several hundred a day. I mean, we're not going to be able to be as thorough as vigilant as doing asking people to be in isolation and in quarantine. I think then we'll just have to say, this is a community epidemic. I think you have to assume that it's everywhere, and again, our healthcare system could get overwhelmed, just like we've seen in Italy and China. I mean, there's no reason to think that if we don't take action now with these non-pharmaceutical interventions that we will end up otherwise. So it's really important that people pay attention and act now to prevent any type of devastation in the near future.
Yeah, it's important that people do the right thing for themselves, their family, and their community. I just retweeted a report from the National Association of Counties of a Florida university that announced that 5 of their students who went on spring break to another part of Florida tested positive for COVID-19. I saw trending on Twitter was COVIDiots, idiots who went out and got COVID-19 because they thought it was cool and they could party. Really, folks, you got to be smart for yourselves and others, and if we can reduce the spread, we will save lives. And that's what this is all about right now, reducing the spread. Next question, I believe, to WIVB Channel 4. Marley?
Yes, thank you. So we've been getting a lot of questions specifically about essential companies. What should those companies who are considered essential be doing in order to keep their employees safe, since many of them have well over what the CDC recommends at 10 people in an area?
Well, they still have to follow basic physical distancing practices. There's about 10 people in this room, and they are all spread out. We understand that there are essential businesses, and it's not always easy to ensure that your business continues. The standards are the same as everyone else. You still have to do physical distancing, and there are some restrictions on how many employees you could have even among essential businesses at a location. That's available through New York State. And if anybody has any questions, they can contact Empire State Development. I think it's it's esd.ny.gov on the internet. And also, if you want to report a non-essential business that's open, please do not call our special COVID-19 hotline in Erie County. You should contact the Attorney General's hotline, and we have that number we've put out before, but go to the New York Attorney General's website. It's one of the first things you see, and you can file a complaint by email or call their hotline with the report of a non-essential business being open. Steve Brown, Channel 2.
Yeah, respectfully, Sandra's question didn't get answered. How did we get here? Were we reliant on New York State's health department for those testing supplies? And were they responsive when you asked for more? How did we get here?
I will say that we got an initial shipment from the CDC. The doc can confirm that.
Right. I mean, we have placed orders with all our vendors that we usually order from and vendors that we don't usually order from. We have been working with CDC. We've been working with Wadsworth to try to attain as much reagent and viral swabs as possible. And this is what we have. It's not from lack of effort. It's just really from lack of availability in the marketplace.
Next question.
Can I ask a question?
I don't know who that is.
It's Jim Heaney with Investigative Post.
Didn't know you were on, Jim. Go ahead.
Oh, well, here I am. I've got a handful of questions regarding the holding center and the Alden Correctional Facility.
Then you
are there any plans?
You probably need to talk to the sheriff's office on that, Jim.
Well, it's the elected leader of the county. Let me ask you a couple. You may or may not.
Just one question.
With the New York State facility, Wendy facility, the New York State Health Department is managing those cases.
Well, no, I'm asking a different question. I'm asking whether or not you're aware of any steps that might be contemplated to release at least some of those who are incarcerated in county jails.
I have not been advised of anything, Jim. I've seen some people who are calling for that, but that has to go through the sheriff's office and consult with the New York State Department of Corrections. I do not have the power to order that. There are certain powers I have in a state of emergency, but I do not have the power to override the rules of New York State.
Do you have an opinion about what you would like to see done in the interest of public health?
Well, the goal is to protect everyone no matter where they are. As was reported a couple of days ago, a sheriff's employee contracted COVID-19 and was in the jail in Alden and left. And then those individuals that they were in contact with were put in quarantine, both employees as well as inmates. We want to ensure everyone's protected from this. Next question to Brandon Lewis, correct, of Spectrum. Brandon, do you have? Okay.
For Dr. Burstein, I just wanted to make sure I understand the demographic where you mentioned the people in their 20s, 30s, and 40s. Were you referring to the people who are hospitalized, or was that referring to the age range of the 87 positive cases?
Both. I mean, we're seeing people of all age ranges, over the age of 20 and up.
Sandy?
Yes, a colleague of mine has been speaking with some COVID-19 patients. They said that when they were tested and found to be positive, that the health department chose not to test any of the family members because they were in quarantine anyway, but that they insisted on testing their children, even though the children were asymptomatic. Dr. Burstein, can you shed any light on that?
I can't discuss any individual cases, so it's, and I'm sorry.
Well, generally speaking, is there some policy for testing involving testing children, even if they are asymptomatic, if they are with other family members who are known to be positive?
Again, I know I can't. Each case is different, and we take this on a case-by-case basis that takes into account other risk factors. I mean, people can have other health conditions that the public may not be aware of that we would take into account. Also, it would take into account the availability of tests at the time. So again, we take each as a case-by-case basis.
So there's no general policies.
Again, we take each at a case-by-case basis, and there are policies, but every case is different, and we follow those policies depending on what the case is.
Brendan from WBEN.
I'm all set.
Okay. Ethan, do you have any more questions?
All set for now, Mark. Thanks a lot.
All right, then this will be the last round for TV or the news. Madison, do you have any other questions? I guess she's not on. Marley from Channel 4, any more questions?
Just one last one. I want to go back to the topic of face masks and the fact that we purchased 1.1 million worth, but there are many people who have been creating their own face masks to hand out to area hospitals. Those aren't compliant. Should caretakers be wearing those homemade masks?
If they haven't gone through a facility that's been approved by the NIOSHA, which is actually an arm of the CDC, I wouldn't necessarily say that it's going to protect you at the level of an N95 mask would. People could wear them, but I'm not so certain that they're going to provide the same level of protection as one that's coming from a facility that's been approved by NIOSHA to do so.
Right, and then also if it is an N95 mask, for people to be able to be fully protected, they have to be fitted, and that goes through a specific medical protocol. So again, if people are just handing out masks, whether they be N95 or approved or unapproved or any type of mask, we don't know that only N95 fitted masks will protect individuals.
Okay, Steve Brown, you have another question?
Yeah, to the efforts to try and get a hold of this stuff, the doctor mentioned a number of different outlets, access points. Was the state health department one of the places that you asked for testing resources?
Oh, yeah. I'm on the phone with Joseph Rubito, who's basically the guy who's controlling the disbursement of these testing kits. Joe and I talk a lot. John Majori, who's a Buffalonian. I've been talking to John a lot. Melissa DeRosa, the secretary. The governor's not always easy to get, and truthfully, I'd rather get the people who can deliver the stuff at that moment. But we've all been in touch with various folks. I know the doctor's been in contact with people from the Department of Health. Our emergency services have been in contact with the people from the Office of Emergency Management in the state. It is not from a lack of trying. And I probably Well, I have my own phone. I don't have a county phone. I don't charge the county, but I'm fairly confident I blew through my plan this month, and I thought I had unlimited pretty much. I didn't have unlimited. I should have probably gotten unlimited because I'm going to get dinged without a doubt this month with all the phone calls and text messages and emails and other stuff I've shared through my phone. So we've been reaching out continually, Steve.
Has the state been responsive to those requests, in your opinion?
They have provided us additional testing agents as well as swab kits. I would have liked more, of course. We also have a limitation on what we can do on a daily basis. They could have given us 10,000 more, and we would not have been able to. We would have been able to maybe swab people, but because we have a limitation on approximately 100 tests per day at most, and we're still doing tests for other counties, though that I dramatically ordered a reduction on. There's still a limitation on what we've been able to test. That's why we're asking people, if you can, go through a third-party source like LabQuest or LabCorp or Quest, but they have limitations. They won't test people who are symptomatic. So there's a whole issue that has to be dealt with. If your doctor's office can do the test, then they should do the test. If they're not incapable of doing the test, well, then you're sort of left with us, but then we have a limitation on what we can test anyway. We've looked at potentially sending samples out, but the labs are all loaded. I talked to the county executive of Monroe County, Adam Bello, and found out that their University of Rochester Medical Institute, as well as Rochester General, have been doing tests, but they can only do a certain number of tests too. So no one's happy about it. We wish we could have done more. We're going to do more in the long run. We don't know exactly what we got today, and we'll let you know what we got today so that we can potentially start doing more swabs and more tests ASAP. But there's still going to be a limitation on how many tests we can actually do per day because of the machines and capabilities that we have.
Thanks for the clarification.
Yeah. With that, Brandon Lewis, are you set?
Yes, I'm all set. Thank you.
Okay. Sandy, do you have any other questions?
Yes. So you will be, can you let us know when you find out, I don't know if that's today or tomorrow, how many of those reagents the county actually received? We would be interested to know. The other question that we had was, of the number of positive cases so far, I don't know, Dr. Burstein, if you have any kind of estimate as to what percentage of those cases are the result of community spread as opposed to travel?
I know that the more recent cases have all been from community spread. I mean, we know that there's really limited travel now outside the United States, and there's also people are not traveling outside of Western New York. So, I mean, I think we can assume, I'm pretty sure, I think all the cases in the past few days have been community spread. And, you know, again, we're not really seeing travel-related cases anymore because people aren't traveling.
With that, we will provide, the number of reagents, kits we have probably later today once we get that information from the Department of Health. And if we are available to reopen the drive-through clinic, which we previously had, we would reopen the drive-through clinic. We're looking at a different location than previous and potential multiple locations if we have enough test kits to do multiple locations. Erie County was actually one of the first counties in New York State to have a drive-through clinic. We had to stop it because we ran out of sample kits, but we jumped on this early, much earlier than others. I know a couple of my colleagues across New York State are announcing drive-through clinics today. Well, they had nothing for the first 2.5 weeks, and some of them had cases even before us. So we've been pretty proactive, and we'll continue to be proactive and attack this as best as we can. This will be the last press briefing for the day, though we will continue to update things. If we get more cases, they will be updated on the map. Let's make certain. See if they got anything. They could have since we went on air. No, looks like the same amount, but I'm fully expecting that number will be updated today. It's quite possible we could go over 100 confirmed cases by the end of today based on what we're seeing and the replication of cases on a daily basis. Take care, everyone. Be safe. Be smart. Don't be a COVIDiot. Don't go out there and party in your friend's house. You're only going to potentially get yourself sick, your friend sick, and of course, you don't know if you have an underlying health condition that could put you more at risk. You don't want to go over to your Aunt Ginny's house and give it to your Aunt Ginny and then have her in a hospital. There have been deaths, lots of deaths in New York State. 2 in Monroe County, now 1 in Wyoming County, and I'm hopeful we don't have one here in Erie County. But the most important thing we can do is to reduce the possibility of spread, so if we have them, it's the least number possible. Thank you, everyone. Take care.